peripheral neuropathy, small fiber neuropathy, and physical neuropathy. Understanding and managing neuropathy, a condition that affects the peripheral nerves, can manifest in various forms, each with its symptoms and implications. Peripheral neuropathy, small fiber neuropathy, and physical neuropathy are commonly encountered. Peripheral neuropathy is a broad term encompassing damage to the peripheral nerves, which transmit signals between the brain and spinal cord to the rest of the body. The impact of peripheral neuropathy on individuals' daily lives can be significant, leading to difficulties in walking, performing delicate motor tasks, and experiencing chronic discomfort. On the other hand, small fiber neuropathy explicitly affects the tiny nerve fibers responsible for transmitting sensory information, such as pain and temperature sensations. Due to its subtle nature, small fiber neuropathy can be challenging to diagnose. Still, it can profoundly impact individuals' quality of life, causing discomfort and impairing their ability to engage in daily activities. This type of neuropathy can be debilitating, causing sharp shooting pains, muscle weakness, and coordination difficulties. The constant presence of pain can significantly disrupt individuals' daily routines, affecting their sleep, mood, and overall well-being. Understanding and managing neuropathy is essential for improving the lives of those affected by these conditions. By recognizing the specific symptoms and challenges associated with each type of neuropathy, healthcare providers can effectively tailor treatment plans to address individual needs. Stay tuned to learn more about the latest advancements in neuropathy management and how you can take control of your health. Understanding peripheral neuropathy, causes, symptoms, and treatment options. The peripheral nervous system is crucial in transmitting signals between the brain and spinal cord to the rest of the body. It regulates sensation, movement, and autonomic functions. Various underlying conditions can lead to the development of peripheral neuropathy. Additionally, confident lifestyle choices such as excessive alcohol consumption or vitamin deficiencies can also contribute to the onset of peripheral neuropathy. Symptoms of peripheral neuropathy can vary depending on the type and severity of nerve damage. Common signs may include numbness, tingling, burning sensations, muscle weakness, and sharp or shooting pains in the affected areas, typically the hands and feet. Individuals with peripheral neuropathy may also experience changes in sensation, such as heightened sensitivity to touch or temperature, as well as difficulties with coordination and balance. These symptoms can significantly impact individuals' daily lives, leading to challenges in walking, performing tasks requiring fine motor skills, and experiencing chronic discomfort. Conventional treatment options may include medications to manage pain and improve nerve function, physical therapy to enhance mobility and strength, and lifestyle modifications to control contributing factors like blood sugar levels or alcohol consumption. In some cases, surgical interventions or nerve stimulation techniques may be recommended to alleviate severe symptoms or restore nerve function. Techniques such as acupuncture, massage therapy, and nutritional supplements have shown promise in relieving pain, improving circulation, and supporting nerve health. Unraveling small fiber neuropathy. Diagnosis and management. Small fiber neuropathy is a distinct type that explicitly affects the tiny nerve fibers that transmit sensory information, such as pain and temperature sensations. Unlike other neuropathy that may involve larger nerve fibers and motor functions, small fiber neuropathy primarily manifests as sensory disturbances. Understanding the unique characteristics of small fiber neuropathy is essential for accurate diagnosis and effective management of this condition. Differentiating small fiber neuropathy from other types of neuropathies is crucial in guiding appropriate treatment strategies. While peripheral neuropathy encompasses damage to both small and large nerve fibers, small fiber neuropathy explicitly targets the tiny nerve fibers that regulate sensory functions. This distinction is essential as small fiber neuropathy may present with symptoms such as burning pain, heightened sensitivity to touch, and abnormal sweating patterns, which are not typically associated with another neuropathy. By recognizing these specific symptoms, healthcare providers can tailor diagnostic approaches and treatment plans to address the unique challenges of small fiber neuropathy. Diagnosing small fiber neuropathy often involves a combination of clinical evaluation, specialized tests, and nerve biopsies to confirm the presence of minor nerve fiber damage. Skin biopsy, a minimally invasive procedure that involves removing a small skin sample from the affected area, is commonly used to assess the density of tiny nerve fibers and detect abnormalities indicative of small fiber neuropathy. Additionally, nerve conduction studies and quantitative sensory testing may be employed to evaluate nerve function and sensory perception, providing valuable insights into the extent and severity of nerve damage. Once diagnosed, managing small fiber neuropathy typically involves a comprehensive approach that combines lifestyle modifications, symptom management, and targeted therapies. Lifestyle modifications, such as maintaining a healthy diet, exercising regularly, and managing stress, can help alleviate symptoms and support nerve health. Physical therapy, acupuncture, and transcutaneous electrical nerve stimulation, TENS, may relieve pain and improve sensory function in individuals with small fiber neuropathy. In conclusion, unraveling the complexities of small fiber neuropathy requires a nuanced understanding of its distinct features and diagnostic criteria. By differentiating small fiber neuropathy from other types of neuropathies, utilizing specialized diagnostic tests, and implementing tailored management strategies, individuals can effectively navigate the challenges posed by this condition and enhance their quality of life. Stay informed about the latest advancements in small fiber neuropathy diagnosis and management to empower yourself and take control of your health and well-being. Exploring physical neuropathy, impact on motor functions and quality of life. Physical neuropathy, a type of neuropathic pain resulting from nerve damage, can profoundly impact individuals' motor functions and overall quality of life. Understanding the connection between physical neuropathy and muscle weakness is essential for addressing the challenges faced by individuals living with this condition and implementing effective management strategies. The link between physical neuropathy and muscle weakness stems from the disruption of nerve signals that control muscle contractions and coordination. When nerves are damaged or dysfunctional, the communication between the brain and muscles is compromised, leading to weakness, tremors, and difficulty controlling movements. Individuals with physical neuropathy may experience muscle atrophy, decreased muscle tone, and reduced strength, impacting their ability to perform everyday tasks and engage in physical activities. The challenges individuals with physical neuropathy face in daily activities are multifaceted and can significantly impact their quality of life. Simple tasks such as walking, standing, and grasping objects may become arduous due to muscle weakness and coordination issues. Individuals may also experience balance, coordination, and fine motor difficulties, affecting their independence and overall mobility. Physical therapy and rehabilitation play a crucial role in managing physical neuropathy. They improve motor functions, enhance muscle strength, and promote overall well-being. Physical therapy interventions tailored to address the specific needs of individuals with physical neuropathy can help restore mobility, improve balance, and alleviate pain. Therapeutic exercises focusing on strengthening muscles, improving flexibility, and enhancing coordination can aid in overcoming the limitations imposed by muscle weakness and nerve damage. Additionally, rehabilitation strategies such as gait training, balance exercises, and functional mobility training can help individuals with physical neuropathy regain confidence in their ability to perform daily activities and navigate their environment safely. Assistive devices, orthotic supports, and adaptive equipment may also be recommended to facilitate mobility and enhance independence for individuals with physical neuropathy. By recognizing the impact of physical neuropathy on motor functions and quality of life, individuals and healthcare providers can work together to develop comprehensive treatment plans that address the unique challenges posed by this condition. Through physical therapy, rehabilitation, and adaptive strategies, individuals with physical neuropathy can optimize their functional abilities, improve their quality of life, and regain control over their mobility and independence. Physical neuropathy, stemming from nerve damage affecting muscle function, results in muscle weakness and coordination difficulties. Early detection and intervention are crucial in mitigating the progression of neuropathy and preventing further nerve damage. By recognizing the symptoms and seeking timely medical evaluation, individuals can receive appropriate treatment and support to manage their condition effectively. Comprehensive management of neuropathy involves a multidisciplinary approach that may include medications, physical therapy, lifestyle modifications, and alternative therapies to address symptoms and improve nerve function. It is essential to emphasize the importance of seeking professional medical advice for neuropathy-related concerns. Healthcare providers can conduct thorough evaluations, perform diagnostic tests, and develop personalized treatment plans tailored to individual needs. By actively engaging with healthcare professionals and following their recommendations, individuals can take proactive steps toward managing neuropathy and improving their quality of life. Understanding the nuances of peripheral neuropathy, small fiber neuropathy, and physical neuropathy empowers individuals to navigate the challenges posed by these conditions effectively. By prioritizing early detection, comprehensive management, and collaboration with healthcare providers, individuals can take control of their health and well-being in the face of neuropathy. Stay informed, stay proactive, and prioritize your health regarding neuropathy-related concerns.